Hi everyone, and welcome back to 2-Minute Teas with TP. I'm Teresa Pun, and here is my bergamot rose that I'm enjoying this afternoon. I'm continuing my series on spontaneous urticaria, aka spontaneous hives, aka chronic idiopathic urticaria. I want to take the next few minutes to talk to you about the utility of certain investigations in establishing a diagnosis or in overseeing the management of spontaneous urticaria. Now, in the past, physicians and specialists used to do a whole slew of blood work. However, over time, most of us are doing less and less blood work if the history is very compatible with a diagnosis of spontaneous urticaria. One piece of blood work that colleagues have asked me about is something called anti-TPO, anti-thyroid peroxidase. Now, this is an antibody that can be found in patients with hypothyroidism. So, what is the connection? In the past, we used to think that patients with spontaneous urticaria and a positive anti-TPO were more likely to have difficult to treat hives or a longer course of illness. We aren't really seeing that bearing out in subsequent studies. As well, we no longer routinely recommend screening for hypothyroidism in these patients unless there is a history or other signs and symptoms that would suggest hypothyroidism. So, in brief, for a lot of my patients with spontaneous urticaria, if they have a classical history, if they also classically respond to typical treatments, I usually do not order blood work in these patients. I do make sure that they follow up if things change, and we reassess at that point. I hope that you found this helpful, and thank you for checking in. Bye.